Thanks for joining me to learn more about the Young Living health plans. We're going to be talking about what health shares are, an overview of the plans, the details of the plans, opportunities for brand partners, holistic practitioners, and small business owners, and then talk about some testimonials. But let's first start off with some healthcare facts that are pretty staggering. 30 million people don't have health insurance. 65 million independent contract workers only have limited and expensive options. A survey showed that 2/3 of people avoided seeking medical help because of financial worries. And statistics from a 2021 survey show that 50% of Americans have medical debt. More than 65% of bankruptcies involve medical debt, and 90% of those people had insurance. The traditional health insurance system is broken. But thankfully, we have Clearwater. Clearwater is a healthcare vendor. They offer affordable health care solutions, including traditional health insurance, health shares, supplemental insurance offerings. They've been around since 2018, and ClearShare, the health share side of Clearwater, is a nonprofit that helps to put healthcare decisions back into our own hands. And we like to think of Clearwater as the Young Living of healthcare. They really want to disrupt the health insurance industry, the same way that Young Living is working to disrupt the health industry. Okay, so what is a health share? So a health share is a community of individuals who contribute all of their money and put it together into a community pool. Monthly contributions are just like traditional health insurance premiums, and those contributions help to pay for medical costs of the members. So health shares have something called an annual max, which works like a deductible. This must be paid before expense sharing begins. But typically, once that annual max is fulfilled, 100% of medical expenses are paid. So it's important to note that this is not health insurance. So in California, New Jersey, Rhode Island, Vermont, Washington, D.C., and also now Washington, they are not seen as Affordable Care Act Obamacare compliant. So you will need to pay for the tax penalty. Talk to your tax advisor. Oftentimes the savings that you're going to get from joining the health share is going to be at a savings that will cover that tax penalty. And even if it doesn't, even if you're paying a little bit more for these services, as you'll see soon, you're going to be getting a lot better benefits. So let's talk about health sharing versus traditional health insurance. Most insurance is for profit. You have a premium that you pay for every month. You have a limited plan of providers. So oftentimes you have a very limited in-network plan of providers. And then if you go out of network, then it's much more expensive. With the ClearShare Health Share plan, there's no network. You can see anyone, anywhere, even outside of your state. With traditional health insurance, you have your deductible and your copayment. So you often go to the doctor, you pay your copayment, and then you still have your overall deductible. With health sharing, you have something called an annual max, which works like a deductible. And then with traditional health insurance, there's typically a high claims denial rate. There's huge departments within health insurance that are looking for the one little thing that will ensure that your claim will get denied. And that's why there's so many bankruptcies due to medical debt. With health shares, there's a low to no denial rate. Once your annual max is met, the rest of the medical expenses are shareable. And then a lot of people will say, oh, well, health insurance, it's regulated. That's what makes it safe. Yes, health insurance is regulated. However, as you could see by those statistics that I shared earlier, it's still a very, very broken system, and it does not guarantee that any of your medical costs are going to get paid. So health shares really put your healthcare decisions back into your own hands and helps your hard-earned money stay in your pocket. So let's talk about the plans. There's essentially 3 plans. So we'll start over here with the ClearShare plan. This is the one where if you just want medical emergency catastrophe coverage, this is the plan for you. Then there's 2 holistic plans. These plans can just be individual plans that you add on to whatever you have for traditional health insurance, whether you get that through your work or the marketplace or Medicare. You can add on one of these holistic plans. So even if you're 65 or older, you can still enjoy the holistic plans. If you're 65 and older, the ClearShare plan is not available to you. And then there's the holistic plus the ClearShare plans, which allows you to have a blend of both holistic and medical emergency coverage. Here's a comparison chart that shows you all of the things that are covered. So with the ClearShare plan, just the medical emergency coverage plan, you're going to get emergency and urgent care coverage. You're going to get $0 telemedicine 24/7, 365 days a year that you'll have available on your phone, and within 10 to 20 minutes of requesting a medical provider, one will be with you to do a medical appointment, to do a follow-up, to do a prescription refill, to assess whether or not you do need to go to urgent care or emergency care, or even do a concussion protocol check. You have something called $0 care coordination services, which we'll go into in a little bit. You have 13 $0 virtual mental health sessions. You have childbirth and delivery services covered. You do have to get pregnant after you enroll in this plan. If you are pregnant and they see that your conception date is before you enrolled in the plan, then that will not be covered. So make sure you enroll in this before you plan on getting pregnant. The childbirth and delivery services also includes midwifery care, birth centers, and home births. The holistic plan gives you the $0 telemedicine, but also $50 to $75 worth of Young Living supplements and oils every month to be reimbursed. Gives you functional primary care doctor visits. It gives you chiropractic, acupuncture, IV drips, and even thermography. So let's get a little bit more detailed in the plan. So ClearShare, the medical emergency catastrophe plan, has no network. You can go to any hospital, ER that you want to. You have that $0 telemedicine that I mentioned before, care coordination, which we'll go into in a little bit, pregnancy, birth center, home birth, and all of these other additional services are included. Massage therapy, if it's for a specific medical need, that's a new need, since once you enroll in this plan and the doctor has a prescription, you can get massage therapy, you can get hyperbaric chamber therapy, you can even get hospice care and other things. So this is a really, really comprehensive plan. Most of these things will require that you have your annual max paid before. Some of them might require pre-approval, and still, that's a pretty comprehensive plan. So that 24-hour telemedicine is through a company called Amaze. So you'll be able to call whenever. If you don't want to leave the house, you don't have to. You can call and have a doctor in your pocket on your phone, or a nurse practitioner at the touch of a button within 10 to 20 minutes, and they can help you with everything that a doctor's office would. And you don't have to leave your house, and you don't have a copay, and you don't have to guess at what your payment is actually going to be. ClearShare does have some pre-existing limitations. So if you've had cancer, a heart attack, stroke, or COPD, then for the first year of being on this plan, there's no sharing of benefits. And then as you go longer with no medical treatment and no hospitalizations, you get higher coverage, but it still gets capped at $125K. And for most of any medical issues, you have that increase over time. So these plans are generally meant for people that are healthy, that haven't had issues. If you do have a history of cancer, heart attack, stroke, or COPD, we've got a plan for you just in a little bit. But what you should know is that high blood pressure, high cholesterol, even type 1 and type 2 diabetes, hypo and hyperthyroidism do not count as a pre-existing limitation. So if you have any of those issues, you can sign up. Even if you have more, any of those other issues like cancer, heart attack, stroke, or COPD, that does not exclude you from being on this plan. So we really recommend that you consult with the benefits consultant to discuss your situation in more detail. So care coordination is an incredible perk that is available through the health share side of this plan. If you ever need x-rays, an MRI, or even a planned surgery, and you're not in a rush and you're willing to wait, you can contact the care coordination team. What they're going to do is research somebody in your area that can do the procedure at the rate that will save them money, but also give you excellent care. So say, for example, you needed a knee surgery. It's not an emergency knee surgery. It's for a new injury that you got once you became a member. You would contact care coordination. They would eventually get back to you within 30 days to let you know the provider that they would like you to go see. This would probably be a surgery center versus a hospital. And the reason why is because surgery centers tend to be much more cost effective, plus have way better outcomes in terms of care and success. Surgery centers have less patient to staff ratio, which means better care and aftercare. So it's going to save ClearShare a ton of money if you go to this surgery center to get your knee surgery versus the hospital. Plus, you're going to get better care and better outcome. So because you're going to go to their recommended provider, they're going to pay for the whole thing, and your annual max will be waived. And so again, these are for non-emergency situations, x-rays, MRIs, major procedures. As long as you're willing to wait, they're going to give you a recommendation. You don't have to use the care coordination recommended provider. You can always go see whoever you want. You'll be required to be responsible for your annual max, and then anything over that will be paid for through the health share. But if you want the whole thing to be free, you can go through the care coordination system. There are some extra perks of ClearShare, like an end-of-life assistance or suicide attempt assistance. So let's get into the nitty-gritty of the plans. I love these holistic plans. There's nothing out there like it. So with these holistic plans, there's $0 telemedicine. There's no annual max with this. You start getting the benefits right away. There's no pre-existing condition exclusions or limitations with either holistic plan. So this plan is perfect for anybody that loves to do all of their holistic services, but don't want to because it's a lot on their budget. So you're going to get your $50 to $75 worth of Young Living essential oils and supplements. You get up to 5 primary care visits per year per person. So this can be also with a naturopath. So again, no network, you can see them whenever you want. So in addition to having that $0 telemedicine, if you did need to go to a specialist, or, if you're a woman and you want to go see the OBGYN for a checkup, you can go see whoever you want. With the holistic plan, you're paying the provider, you're submitting your receipt to the health plan, and within 30 to 45 days, you get a cash reimbursement via direct deposit or check. So with these doctor visits, you're going to get up to $150 a visit reimbursed. You also get breast imaging 1 time per year. That includes thermography. Again, you'll pay the thermography person, you'll get your receipt, you'll submit it, and then you will be responsible for the first $150, and anything over that will be reimbursed. Chiropractic and acupuncture, you get up to 24 visits per calendar year per person. Any combination of acupuncture and chiropractic. You can see them whenever there's not a medical need required. If you had a medical issue that you wanted to get a lot of visits all in 1 month, you could. Again, you're going to pay the chiropractor or acupuncturist up front at your visit. You're going to submit your receipt, and you're going to get up to $175 reimbursed. You'll end up having $35 of whatever you paid taken out of the reimbursed amount as a visit fee. So what we recommend for your chiropractic and acupuncture visits is add on something else so that you can really maximize that $175 reimbursement. So if your chiropractor has a massage therapist or other services, if your acupuncturist has cupping, gua sha, other additional services, add them on so that your visit total is 210 or more. 210 is the $175 reimbursement plus the $35 visit fee. That means you'll be getting the acupuncture plus the gua sha, the chiropractic plus the massage for $35, up to 24 times a year. Anything over that 210 is your responsibility, so add it on and you're basically getting so much of your appointment for free. With the holistic plan, you're also getting 1 IV drip per month. Again, you're paying for the IV drip, submitting your receipt. You'll end up paying $25 out of that reimbursed amount, and then you will get $100 reimbursed every single month. Anything over $125 is your responsibility. There's also some generic prescription benefits for the holistic plan. The holistic savings plan is another option. So again, this gives you $0 telemedicine, no annual max, no pre-existing condition exclusions. These plans can be added on to traditional health insurance, whatever you have for traditional health insurance. So you get that Young Living oils and supplement reimbursement. You get 3 doctor visits, including the naturopath, and you get 12 acupuncture or chiropractic visits combined per person per calendar year, where you're going to get that $175 back. So with the essential oil or supplement reimbursement, this is only for Young Living products, but any oil and any supplement purchased through the Young Living website, up to $50 for individuals and up to $75 per month for members with more than one person on the plan, gets reimbursed every single month. Again, it's just a direct deposit to your bank account. So it's really fantastic that this plan, either of these holistic plans, really helps you take care of yourself, be proactive about your health and wellness by using your oils and your supplements and seeing all of those really awesome holistic practitioners and get those add-on services as well. Here are the prices for Clear Share only. So this is for the medical emergency plan only. So there is a $1,000, a $2,500, and a $5,000 annual max. And then it's also divided up by age tier and whether or not you're single, married, or cohabitating, single with kids, or family with kids. So there's no limit on the amount of children that you have. So if you have 6 or 8 kids, it's all still one price. And this is one price for the whole family per month. And it also covers unmarried children up to the age of 26. So these plans are great for healthy people that don't go to the doctor a ton. You can still have emergency medical catastrophe coverage, and you'll have that annual max or deductible of $1,000, $2,500, or $5,000. These are the prices for the holistic plan. So the holistic savings plan versus the holistic plan, it's not significantly more, but you get so much more with the holistic plan versus 12 versus 24 chiropractic acupuncture, 3 versus 5 doctor visits. With the holistic plan, you're also getting that 1 IV drip per month and the thermography once a year. So a reminder, no annual max with either of these holistic plans. There's no pre-existing condition exclusions. And You can use these plans as an add-on to your traditional health insurance or for an add-on for Medicare. So it's really amazing that this plan is really here because the company sees the benefit of us being proactive. They want to reward us now because they know that people that do all of these holistic modalities and do all these things to be proactive tend to be less sick and long term have less chronic disease, which tend to be the more expensive things. So they're willing to pay us now, and we can even make a profit. I'll show you in a minute. So next up is the holistic savings plan plus the ClearShare plan. So this is the one that has the 12 acupuncture chiropractic visits plus the ClearShare medical emergency catastrophe plan. Again, it's divided by the annual max and your age. Next is the holistic plus the ClearShare. So again, the increase in price is not hugely significant, but you get so much more with the holistic versus the holistic savings plan. So definitely something to look at. So let's talk about how much you could save. If you just did the holistic savings plan, which is $173 a month for an individual, no age limit, no pre-existing condition exclusions, and you went to the chiropractor and got an adjustment and a massage at the same time, and you ordered $50 worth of oils or supplements in 1 month, that would be $260 out of pocket. But if you had the holistic savings plan, you would actually get $190 reimbursed, which means you would get a $17 profit. Same thing, here's an example of acupuncture. You get acupuncture plus cupping plus your $50 Young Living order, you're going to get $190 back. You get $17 back in profit. And here's an example of the holistic plan, the one that gives you the 24 acupuncture chiropractic visits. You could go see your acupuncture and get cupping, go see your chiropractor and add a massage, get an IV drip, buy your Young Living order of $50. And if you did not have this plan and you had to go see a doctor, the minimum you'd probably pay out of pocket is $150. So that total would be $745 in 1 month. I don't know a lot of people that are going to do all of those things, right? But with this holistic plan, just the holistic plan, not even including the ClearShare plan, you would get up to $405 reimbursed for all of those services, which means you would make a $172 profit that month for being proactive with your health, which is amazing, especially with all the prices of all the things rising. Here is one way we can get better health care, get better wellness coverage, and take care of ourselves, get better self-care, and make a profit. And again, like I said, the company is willing to invest in us because they know that people that do all these kinds of services tend to be healthier. Here's an example of the holistic plus the ClearShare plan. So if you had to go get a prescription refill at your doctor's office, that'd be $150. Acupuncture plus red light. If you went to go see a naturopath, at the minimum, that would be $155. An IV drip, a chiropractic adjustment, a massage, plus $50 of Young Living. Out-of-pocket costs would be $915. But if you had the holistic plus ClearShare plan, your total reimbursement would be $505, meaning you would still make a $55 profit. Isn't that amazing? So it seems too good to be true. However, it is not. Preventative care, we know, leads to lower long-term costs and healthier people going to the doctor less often, fewer expensive interventions, and ClearShare wants to reward us for that. So if you're familiar with health shares, or maybe you are on a health share, here's a comparison chart that shows you what ClearShare plus the holistic plan compares when you look at Samaritan, which is a Christian health share ministry or impact health sharing, and you will see that our plan is going to give you way better coverage. There's no annual or lifetime limit with these other health shares. There's often a per need or per year limit of what is covered. And then there's no restrictive sharing limits, no waiting period for maternity coverage. There's no network, whereas the other ones do sometimes have network limits. And we've got the $0 telemedicine and wellness preventative care. Our plan just blows everybody else's out of the water. There's nothing out there like it. So let's talk about who's eligible to be enrolled on one of these plans. Any Young Living brand partner or customer in the United States is eligible. If you're not a Young Living member, you can become one simply by signing up. You will automatically get a Young Living member account made for you. You're not required to ever buy any Young Living product, but if you're going to get $50 to $75 worth of product for free, you might as well. Anyone over the age of 65 is eligible just for one of the holistic plans. Any unmarried children up to 26 years old are still included on their parents' plan. Anyone with an ITIN, and there's a year-round monthly and open enrollment. So it's not just only certain times of the year that you can enroll. You can enroll anytime, any month. If you have a spouse or a partner, you might want to sign up your spouse as the person that has the health plan on their account. That allows you, if you want to earn commission, that gives you the ability to earn commission on your family's health plan. It's not going to be a ton, but every little bit counts, right? So if you have health coverage through work, you still might want to consider thinking about, if you have other family members that are on that same plan, taking them off your work coverage and putting them on the ClearShare plan, or just adding the holistic savings or holistic plan for them so that they have the $0 telemedicine and all the holistic benefits. You can still stay on your plan through work if you get it for free, but your family more than likely is going to save a lot of money by switching to the ClearShare plan and or the ClearShare plus holistic plans. So there are some supplemental benefits that are available. Dental, vision, accident coverage, that's an add. All of these are add-ons. I'm not going to go into these too in depth. It basically gives you the general basic dental coverage and the basic vision coverage. If you have you want accident, critical illness, or hospital indemnity, these are in addition to what ClearShare would cover. You can get that. If you'd like to watch a pre-recorded webinar about any of these plans or get a quote, you can scan this QR code. Each of these QR codes will take you to the main website that will give you the option to watch a webinar, schedule a one-on-one consultation with a benefits rep, or get a quote. If and when you're ready to sign up, you're going to go to the main website. You're going to use your friend that referred you to the plans, either their link, or make sure you have their member number so that you can put that member number in the box that asks who referred you. You're going to choose the plan you want, follow the prompts, and you want to enroll in the month before you want services to start. So if you enrolled this month, you would not have any services, and you would also not be billed for anything. The first of next month, you will have services available right away, and then you'll be billed between the 5th and the 10th of next month and every subsequent month that you are a member. So these are the income opportunities. If you're looking to earn some extra income, this is something to look into. It's a reliable recurring income that's great for individuals or small business owners, holistic practitioners. So what are the benefits for a holistic practitioner? You can offer healthcare savings to your patients. There's no network. They can see you and have no medical need limitations for your services. you will have an increase in revenue because you'll be able to recommend add-on services that your patient or clients will be able to get reimbursed. This is going to add a recurring income stream to you. There's no risk to you because your patients or clients are going to pay you up front. All you are going to have to do is provide them with an itemized receipt. So your patients are going to save money on more services, which hopefully means they're going to be able to see you more often. Small business owners with less than 49 employees, it's not required for you to provide health insurance to your employees, but this is a way that you can offer a special perk as an employee of your company. There's no additional cost to you because you're not paying for it. You can just share your link or my link with your employees. They can sign up for it, and there's a recurring income stream from every person that is enrolled. And even if an employee quits, as long as they're paying for their health plan, those commissions will still occur. And it's kind of something to think about in terms of an employee retention tool. Your employee will pay for their plan, but because you will be eligible to earn commissions, you could give them a stipend or a small percentage based on how many years they're with you, maybe 10% if they stay for a year, 20% for 2 years, and so on, and increase that over time as a perk of being an employee and staying with you. Even if you're a big business owner, more than 49 employees, and providing health insurance for your full-time employees, you can still work with this plan. So even if you have a MEC health insurance requirement, you can still work with Clearwater, the parent company, to get your traditional health insurance offerings cheaper and offer the health share as another option with the holistic health plans as another option. There are some people that have companies that have 1,000 or so employees, and they are saving so much by going through Clearwater for their traditional health insurance offerings that they are going to be able to offer the health share plus the holistic savings plan to their employees at a lesser cost than it was costing them for traditional health insurance. So this is something, again, that you can look into with Clearwater if you have a big business. So let's talk about how you could earn money. So if you take this example of a 40 to 49-year-old with a family that enrolls on the holistic and ClearShare plan, that will be 101 point value. And then they're eligible for $75 worth of Young Living products. So that's 75 point value. Per month, you would have 176 point value for that one family. And if you look at that chart, if you had 57 of that specific scenario sign up, you'd have overall group volume of over 10,000, which is what a silver in Young Living has. So if you look at the bigger chart of the 2024 income disclosure statement, that's going to tell you that the average income of a silver is $18,000 a year. So it's not a ton of money, but having that recurring income, extra income, is a wonderful thing to add and diversify your business. And you're earning commission twice. You're getting the commission from the health plan, but also the products. And as we know with Young Living products, people often fall in love with more and more and more products the more that they try. So the options of increasing that revenue are there with educating your clients or friends or employees about the Young Living products. And that's what I'm here for. I can do those educational calls to help whoever's on the health plan learn more about the products. So let's take this example as a business owner. If you had 100 employees or clients, enroll in just the holistic savings plan. That's the one that has the 12 acupuncture or chiropractic visits. Let's imagine that you have a wellness center and you promote this as a wellness membership plan. to your clients. They can pay $173 a month, and they're going to get more than $173 a month if they're getting a service, a chiropractic adjustment, or an acupuncture session, plus an additional service, plus the $50 worth of Young Living product, right? They're going to get that $17 worth of profit. So they're basically getting massage and a service plus a service for free. That's going to give you 6,600 point value total. So for months 2 and 3, you're going to earn 25% of that point value, which is 1,650 in months 2 and 3. And then months 4 plus, you would earn 8% of that point value. So it would bring you $528 a month, which is nice. That's another extra little income that will just keep showing up month after month. So people sign up for the health plan the month before they want coverage to start. Then the coverage starts the following month. They're going to be billed between the 5th and the 10th of the following month. The point value of whatever plan they have will be added into, if you're a Young Living brand partner, into your back end by the 25th of the month, and then you'll be paid the following month. So we only really get paid the second and third month of someone being enrolled, because the first month nobody's getting services and nobody's paying anything. So next up, Clearwater is the one that is signing people up. They are licensed to sell health insurance and the health shares. They're the ones collecting payment, and Young Living is supporting the whole process and paying the commissions. So if you're ready to start sharing and you'd like to earn commissions, you can sign up to be a brand partner for free. If you're an existing Young Living customer, go to the My Account section and upgrade to a brand partner for free. If you're new to Young Living, just create an account, then contact customer service to request an upgrade to be a brand partner for free without having to make a purchase. This QR code sends you to our Facebook group that has lots of resources and information if you want to learn more about the plans or learn more about the business side of things. So let's show some testimonials. Allie has been using this plan and is loving that it fits with her holistic needs that her family loves. This person, Shelly, was on a different health share for years and it didn't cover holistic services, and now she is loving having all of these reimbursements. This is Yvonne. She's paying $800 a month for a health plan that she rarely used with a $10,000 deductible. Now with these health share plans and the holistic plans, she's getting to see the holistic practitioners that she wants to see and still have the backup of traditional health options if she needs them. This is my testimonial. We're saving over $20,000 a year just in our monthly costs. We had a PPO that we rarely ever used, and now we're saving $20,000 a year plus getting $500 to $600 a month in reimbursements for our holistic services. This person has had a bee sting on a Friday between her cheek and jaw, and she tried all the things using Young Living. She had to leave town, but Saturday she woke up, it was red, really itchy, swollen, and she was getting worried. So she was able to call the telemedicine on Saturday, get that service for free, got a prescription filled, and was able to take care of everything in the middle of nowhere in Texas, and gave her peace of mind of knowing she was going to be fine. So this one shows a member saving $450 on their plan, saving $170, saving $780, and that's not even including the holistic reimbursements or Young Living reimbursements. This person submitted a $195 claim for x-rays and a chiropractic visit, and she got reimbursed for all of it. And then other testimonials of saving money. And again, this person is loving this plan. She was not insured because she couldn't afford it after getting divorced. And now she has the ability to be able to see her naturopath, see her holistic practitioners, and save money and earn some extra income. And this person is sharing with chiropractors, acupuncturists, naturopaths. This other person is loving the telemedicine, being able to get what they need taken care of and using care coordination for free. So that's it. Thank you so much for joining us. If you're new to Young Living and haven't purchased in the past 13 months, please get a referral link from the friend who shared this webinar with you. For existing Young Living members, you can visit the health plan website for a complimentary quote, schedule a one-on-one consultation, or enroll in the health plan. So that's the website right there, yl.clearwaterhealth.com. Also, please join our Facebook group to learn more. So that's it. Again, contact the person that shared this with you. If it was me, I'm happy to answer all the questions. The main thing to know is you don't need to know all of this. You can share this video or just send people to the actual Young Living Clearwater Health website so that they can schedule a one-on-one consultation with a benefits rep or look at all the material on the website, which there is a ton. So thanks again for joining me, and I look forward to having you be healthier and saving money with these health plans. Bye.